Cognitive behavioral therapy and family therapy are the chosen combined interventions for a young woman named Eva. To the average eye, Eva is just another mugshot and a disappointing statistic with a large likelihood of returning back to the prison system. To social workers, Eva is a person with a good heart who happened to have a rough upbringing that made life difficult to maneuver. Social workers see Eva's ability to be a contributing member to society and potential to be great at whatever she wishes to be. The average eye tends to focus on Eva's negative points, considering she was recently released from prison, was a gang member, is a drug addict, comes from a poor background, had parents who neglected her, and was abused. They see that her only positive role model passed away when she was 10 years old, and from that point forward she made bad decisions like living with an abusive and addicted boyfriend. However, who is Eva? Is Eva all of those negative things? Does Eva have any positive attributes? There are many cases that sound like this on the negative side and lack hope for for change in the future. But Eva has made great strides in prison to change for the better. She not only was working hard in prison in GED courses, but wishes to continue this outside of prison. Thanks to her youth, she is young enough to also enter college after her GED is earned, which would give her endless opportunities in the workforce. The medication she was prescribed in prison did wonders for her violent outburst as it reduced her paranoia. Who does Eva represent? That both the African American community and women imprisoned. A quote from Bryant, 2004. Women are far more likely than men to be nonviolent offenders. 60% of women in prisons are serving time for drugs and property offenses, compared to 41% of men. Nearly half of women prisoners have never been convicted of a violent crime. A reference to Bush Baskett, 1998. Since the war on drugs, the incarceration of black women went up 828% between 1986 and 1991. The war on drugs is often referred to a war on African Americans or a war on race. What are Eva's concerns as she is reintegrating into society? Her first concern is insurance. How is she going to receive her medication? How is she going to pay for it? Her second, she really would like to have a job as soon as possible because she does not want to be a burden to her aunt and uncle. Her third, she would love to receive her GED in order to help her chances of better employment. And last but not least, she needs a new group of friends. Friends who are law-abiding citizens, good and supportive. This is also a requirement by the government to help her avoid re-entering the gang system. Immediate action is what has to happen before a mental health intervention would be of any use, as Maslow's hierarchy points out in the picture to the right. If she cannot receive her medications and feel sane on a physiological level, and she cannot feel safe, then her concerns for social esteem and self-actualization will not come into play. Thus, it is imperative that as a social worker, my first jobs are to sign her up with ACA insurance, contact a psychiatrist that donates time for the cause, and find an alternative way to pay for the first month's prescription until ACA health insurance is activated. There is a website, www.needymeds.com, that often has coupons that can help people in need. In Nashville, Magdalene dedicates jobs making soap to former prostitutes to keep them off the street. And Burger Up has hiring that reaches out to those reintegrating into society after prison. These businesses, as well as other businesses with similar goals, will be suggested to our client to give her the financial kickstart she needs to survive. Another local organization created by one of Dave Ramsey's employees outreaches to prostitutes in Nashville and former prostitutes, hosting financial independence seminars so that they will not return to the life of prostitution in the streets. It helps them get on their feet and feel solid. Strictly Females teach the courses, but both males and females help organize the information for each class and assist in reserving rooms to host courses. The next step is the mental health intervention. After gathering a history, assessments and screenings will need to take place. The PTSD screening contains the 2 items from each of the re-experiencing, avoidance, and hyperarousal clusters that correlate most highly with the individual cluster score. Respondents rate items on a 5-point scale with Lang and Stein's example of repeated, disturbing memories, thoughts, or images of stressful experiences. Not at all, 1. 2, a little bit. 3, moderately. 4, quite a bit. And 5, extremely. When their scores add up to 14 or more, this signifies a PTSD diagnosis. Eva, for our purposes here, has tested positive for PTSD. On the right, we have a picture of the brain when it is currently experiencing PTSD. All of the red blotches of the brain are where the brain is highly activated 24/7. This part of the brain never calms. It is overactivity. After treatment, the brain then returns to a calmer state unless true danger is in the way. Here we can see that the red blotches have highly reduced after EMDR sessions to small little red dots. This signifies normal function in the brain. Due to the complexity of Eva's intense past and diagnosis that requires medication, a systematic approach of cognitive behavioral therapy and family therapy is suggested by Aya Asen, and this appears to be the best approach. The majority of subjects stayed with the program all the way through and continued their practices there after the study came to a close. There was a higher likelihood subjects would drop out when only participating in cognitive behavioral therapy, and about 3/4 of the subjects dropped out if the study involved medications to treat the symptoms and nothing more. In the case of Eva, this combination intervention will address all issues Eva is facing. So why family therapy and cognitive behavioral therapy? The family therapy will be to create structure, build trust, and start goal setting so that each party in the family is happy. This will only go smoothly with cognitive behavioral therapies, eye movement desensitization and reprocessing, and bibliotherapy in place. Why EMDR? EMDR is an evidence-based practice that has been proven to treat PTSD, although the precise reason as of how EMDR works remains a mystery. EMDR is thought to activate REM sleep while a client is awake, helping them process the traumatic memories and release all of the negative emotions. After treatment is complete, the calmness returns and normal thinking begins. Why add bibliotherapy? Bibliotherapy is thought to be a good choice, according to Miller, as he found that the youths were able to relate to the characters in the books, and as a result of the discussions, evidence more positive self-esteem. Miller in 1994 also experienced success in using literature to enhance the self-esteem of youths with learning and behavior. For our cases here, this is a great way to help monitor the progression of her treatment, how Eva feels her treatment is going in both EMDR and in her family therapy sessions. Last but not least, this is also a good way to monitor her improvements as far as reading is concerned. She did test poorly when assessed for reading. And cognitive psychology would prove that practicing this reading and then also moving from one level to another would help enhance her reading skills as well as motivate her as she sees her progress. Her progress will be closely monitored with expectations of a full emotional recovery within 2 years.